Everybody. My name is Dr. Ijeoma of Ijenwa Fertility, and at Ijenwa Fertility, we'll choose to start this series where we'll be talking about different issues that are affecting fertility in one way or the other. And today, I want to talk about the role blood sugar plays in fertility. Blood sugar is equally what we call glucose in the blood. And sometimes some people visit some fertility expert or go out to buy fertility supplements without actually finding out if their blood sugar is high or if it is fluctuating. If your blood sugar is either high or fluctuating, it affects both male and female reproductive hormones. So if you're a man having high blood sugar, you will notice that you will be having low sperm count, low morphology, low motility. And if you're a woman having high blood sugar or unstable glucose, you will be having hormonal imbalance. Your body you'll be having what we call insulin resistance. You'll be having what we call low progesterone and low egg production. What we call you'll be suffering from mostly lack of ovulation, or what we call anovulation. We all know about a lot of women suffering from PCOS. And PCOS is as a result of insulin resistance in the body. As a woman, when you're having insulin resistance, you see that the body will be struggling to produce more male hormones and low egg in the woman. You see that woman having a lot of male hormones, a lot of, you see her adding weight, having beards, you see her having low egg reserve, you see her having poor ovulation as a result of the excess insulin in her body. Equally, in a woman, this excessive blood sugar equally causes what we call oxidation stress. When it's chronic in a woman, it causes what we call oxidation stress. When a woman is suffering from high blood sugar, it affects the ovary, it affects the womb too. How does it affect the womb? You see that it ends up destroying a lot of vessels that will end up reducing the level of oxygen that flows to the womb, thereby causing poor oxidation and making it difficult for an embryo to survive in the womb. High blood sugar, or glucose as we know it, when it's high or when it's fluctuating in women, it causes very serious infertility challenge. So as a woman, when you go out to go and buy a lot of supplements, or when you go out to buy a lot of fertility treatments, have you checked your blood sugar to know if actually that is what is causing your infertility problem? In male fertility, how can blood sugar reduce male ability to produce? One, it reduces the sperm quality, thereby making the man produce lower sperm, causes low morphology, causes low motility. And it also affects the sperm DNA, lowering the man's chances of being able to impregnate his wife. High blood sugar causes hormonal disruption in man. How? You see that it reduces the man's testosterone, thereby reducing his libido and reducing his sperm DNA. So you see that when the man goes for hormonal imbalance, the level of this testosterone is lower than the normal range. Another thing this thing does is it affects how do I put it now? When you are having long-time blood sugar problem, it affects your erection. Thereby, the man will start suffering from erectile dysfunction because a lot of vessels, a lot of nerves have been destroyed. So you see a lot of men, they'll tell you, I'm no longer having erection, this, that. Have you checked your blood sugar to know if your problem is blood sugar related, instead of going about buying a lot of medication or buying a lot of supplements, have you really checked your blood sugar? I find it very funny when a lot of people come to the clinic, they don't even know their blood sugar level, they don't even know their BP, and such person is treating fertility issue, forgetting that both high blood pressure, high blood sugar affects fertility. So, as a man, as a woman that is trying to conceive, and you find out you are having high blood sugar, or you find out that your sugar is fluctuating, what can you do? These are the few things you can do to help you. If you've gone for your vital check and you find out that your blood sugar is higher than what is expected, number one thing I will advise you to do is to eat well. We cannot underestimate the powers in the food we eat. In nature part, we are taught that let your food be your medicine and your kitchen be your pharmacy. You can actually correct blood sugar through feeding well. Number two thing is, please run away from refined sugar. If you are having high blood pressure problem, high blood sugar problem, run away from refined sugar. Run away from processed foods. Run away from canned food. Another thing you should do is make sure you exercise regularly. You must not go to a gym to do your exercises. Walking is a form of exercise. Instead of entering vehicle or entering keke or entering okada all the time, learn to walk. Make sure at least every day you do 1,000 steps. Is a form of exercise, and it will help. Another thing you should do as a trying to conceive couple that is suffering from sugar problem is to avoid stress. I know most of us that live in the city will go through a lot of stress every day. Fine. Do all you can to minimize your stress level. Then there are people that they are the ones that bring stress to themselves. Why some people is their work. But please try to manage your stress. And above all, learn to sleep well. At least have at least 8 hours of sleep every day. 8 hours of sleep is very necessary. So if you've gone through the whole stress in the day, the least you can do for yourself is to sleep. So while you are sleeping, your body, your cells are resting, your organs are rebuilding itself, they are rebranding and rebuilding themselves, while your liver is detoxing the toxins in your body, which will thereby help to bring down your sugar level. Then above all, please go and see your health practitioner, mostly your fertility expert, that will help you manage your blood sugar so as to help you conceive. Like I said, this series, we've started it and we'll be having this discussion every Friday, where we'll bring out different problems that will be affecting fertility one way or the other, or the things generally that affect our health. So keep a time with us next week. We'll be discussing another important topic. Then I will give you the time for question and answer. We'll make it 30 minutes in a week where we'll be having our questions and answers. So if there's any question bothering you, we'll give you 30 minutes where you can ask your questions, and I myself will answer those questions. Thank you and God bless you.